So up next, we'll be looking at the epidemiology of acute kidney injury in children. Epidemiology. So epidemiology, you are just trying to you picked a particular disease condition, then you are looking at how this disease condition has affected the world at large. Okay, so for acute kidney injury in children, you are trying to look at which areas of the world are receiving the highest heat and all of that. So for acute kidney injury in children, we said that it's a growing concern in pediatric medicine because it's unfortunate to actually find a little child and you are now having them that they are having issues with kidneys. Alright, something that we usually see in people that are around 70 years plus. So a little child that should be in school enjoying life is hit by issues in the kidney, so they have to be in the hospital. So the prevalence, we say that it affects a significant proportion of critically ill children, especially in neonatal intensive care units or pediatric intensive care units. Okay, so in resource limited settings, studies show that the AKI prevalence about 1.6. If you gather all the children hospitalized, at least 1.6% of them should be having issues with the kidneys. Okay, so age distribution, neonates and infants are particularly vulnerable. This is because their kidneys are still immature, they are just coming up. Okay, and there's a higher susceptibility to infections and dehydration. Then geographic variation, so most data come from high income countries. Do you understand? So it's the high income countries that don't really even have these issues. They are the ones that still have money to sponsor projects that will make us have data for this. So the countries receiving the real hit of these acute kidney injuries are not even really reporting it. So it's underreported in low income regions and middle income regions. Okay, and of course these regions are mostly being hit by the sepsis and malaria. So of course they are receiving the most cases of the acute kidney injuries. So risk factors and causes. Okay, what could make it very easy for you to actually have acute kidney injury? If you have a bloodstream infection, that's sepsis. Of course, blood flows to the kidneys too. Okay, severe malaria, nephrotoxic medication. So you are taking some drugs that are stressing the kidneys so much. Dehydration from gastroenteritis, congenital heart disease, COVID-19, and multi-system inflammatory syndrome. Okay, so you can have the one that you got it from the hospital, you can have the one that you got it from the community. Alright, so those ones, we'll discuss them in a separate video. So diagnosis, if you want to actually confirm that a patient has acute kidney injury, you look at how they are filtering out the waste product called creatinine. You also look at the amount of urine they are able to produce. Okay, so outcomes and prognosis. Increased morbidity and mortality, especially in severe cases. If the case is actually getting severe. Okay, high need for dialysis. Okay, so for long-term issues, it could progress from being acute to being chronic. There's impact on the quality of life of the person. Okay, and all of that. Okay, so this is it for the epidemiology. Just a glance. Okay, look at how this disease condition is affecting children worldwide.